Okay, there we go. Hello, everybody. Happy Saturday. It's the end of October. Thank you for joining us live. My name is Aisha Harley, and I am one of the producers of the Essential Oil and Science webinar and series that we have going on here. And I am really excited about the topic today. We have two incredible presenters, and we're just going to hop on in. So, Ariana, please go to the next slide. We are going to be talking about long COVID and the kind of what can happen if you do become ill, and if this illness wants to hang on for a long while and hang out in not the good ways. So we have Ariana Harley, who's going to be sharing her personal experience, and then Dr. Jenny Tafrankian, who has done a lot of deep dive research. She has treating people in her own clinic and has a wealth of information to share. So I'm going to go ahead and move on to the proper introductions here. But if you are joining us on Facebook, please do say hello in the chat and let us know where you are tuning in from. And then also, if you have any questions as we move through the webinar, please put them in the chat, and then we will answer the questions possibly as we go, but also at the end of the presentation. So our first guest is Dr. Jenny Tafrankian, naturopathic doctor. She is joining us from Portland, Oregon. She is a licensed naturopathic physician, a functional medicine educator, an entrepreneur, and a mom. And she specializes in empowering people to rediscover their core vitality. She has been in practice. Oh, I'm guessing, Dr. Jenny, has it been like 20 years at least?
Yeah, crazy. I know.
That was my guess, but
yeah.
I've actually known Dr. Jenny just for about that long. So
exactly. Yeah.
And
what happened?
I know, right? If you take a screenshot of the slide there, you'll see her website, her email, her Instagram page. She has an incredible YouTube channel, Natural Healing with Dr. Jenny, and she is also on Facebook. So this is definitely somebody that you want to stay connected with. And let's go to the next slide, please, Ariana. And then it is also a great honor to introduce Ariana Harley, who is an emotional coach. And she offers supportive space to connect with your innate wisdom. She has studied at Clear Mind International. She is a certified Kundalini yoga teacher, and she has a BFA from PNCA here in Portland, Oregon. She does an incredible call once a month called Oils A to Z, which she partners with some other leaders in our community and does a deep dive into all of our beautiful essential oils. And she can be found at her website, which is arianaharley.com. She's on Instagram, Facebook, and also there is her email. And I'm also very proud to say that she is also my younger sister. So her and I live next door to one another, and it's been such a pleasure and joy to work together and to partner on our essential oil journey. So let's go ahead and go to the next slide. So we do want to give you this disclaimer, and that is that nothing in this presentation is meant to diagnose or treat you. It is for informational purposes. It is meant to empower you. It is meant to give you information so you can make your own grounded decisions that are right for you. And we have Ariana, who again will be sharing some of her own personal story. She will also be sharing her own personal protocol. And then Dr. Jenny is going to talk to us how to build your own protocol for whatever your circumstances are, whether it's just to stay healthy, to build your immune system, to help get over an infection if you've been ill, etc. So Ariana, I'm going to pass the floor on over to you.
Sure, thank you, and just welcome everyone. So I'm going to be telling my story as we go through this presentation, and then Dr. Jenny and I are just going to do this a little bit more conversational style. But I'm going to give you now what is listed as the symptoms of and explain what is long COVID. But I found out about it before I even saw anything written. And so I thought that I had the flu in February of 2020 because I had vomiting and diarrhea. And they were saying at the time that that was not COVID symptoms. We know that that has changed. We've learned so much since then. And about, let's see, it was the end of March, I was really, really sick. And I just want to say thank you. I just want to take a moment actually to thank all of the healthcare workers, the doctors, the mental health care workers, the essential workers in this world. I have a profound gratitude, and they are out in the fields working at this moment incredibly hard, high stress. So one, I just want to say thank you. And thank you to Jenny because she has done so much research. So moving on from that, my sister actually mentioned to a dear friend, an acupuncturist of ours, so blessed to have all this amazing community of doctors around me, that I was really, really sick. And this dear soul actually called me up, asked my symptoms. She had been in conversations about COVID from doctors all around the world because this was so new, right? And she was the one that said, Ariana, I think this is COVID symptoms, and I think this is the aftermath, is what she called it at that time. And so since then, I have been learning and experiencing what we were originally calling long haulers COVID, and now we're calling long COVID. So what is long COVID? I just want to give you, this is more info that Jenny sent to me, that it's just been recognized by the World Health Organization recently. And the term was created really from people who just weren't getting better from COVID. So the initial sickness happened, then I thought I was getting better. This is pretty common. And then 4 or 5 weeks later, I was bedridden. And we'll talk about this, but I had symptoms that were very unlike my underlying symptoms and the flu or anything I'd experienced before. So the term was initially coined by patients to describe reoccurring symptoms. The National Institute for Health and Care Excellence and the Scottish Intercollegiate Guidelines Network and the Royal College of General Practitioners in the UK use the following clinical definitions for long COVID. Acute COVID-19 signs and symptoms of COVID-19 continue up for 4 weeks, but then there's an ongoing symptomatic COVID-19 signs and symptoms. And so they're continuing from 4 to 12 weeks. And then, so that's ongoing. And then the post-COVID-19 syndrome, the signs and symptoms that develop during or after an infection consistent with COVID-19 continue for more than 12 weeks and are not explained by an alternative diagnosis. So that was very wordy, but in short, I'm still experiencing some symptoms, but I'm feeling so much better. But the intensity of it, I would say, lasted for probably 6 to 8 months for me. So I'll tell you a little bit more about that. So what are the symptoms? So the most commonly reported symptoms are going to be fatigue. So the fatigue I experienced wasn't like, oh man, I'm just tired, I need to go sit down. I was so exhausted that I had to plan out going to the bathroom. I couldn't get up to get a glass of water. Mm-hmm. And at the time it was very difficult because even my family, it was going on for so long that people, my mom, my partner just started talking to me about depression and, and I was trying to explain to them, no, like depression's very real. I'm not making a joke of it. I struggle with depression, but this is very different. Shortness of breath. So I would get winded just walking up the stairs and feel like I couldn't breathe, which is not normal for me. A cough. So I still have a lingering dry cough, joint pain, intermittent, excuse me, I'm not saying that word correctly. I can't get it out of my mouth, but a fever that comes and goes. And then chest pain. And I experienced a tightness in my chest. It just felt like someone was squeezing my lungs. And then some other reported symptoms include difficulty with thinking and concentration. So that's known to us as brain fog. So I had a friend suggest that I could still, like because I was resting, I could, maybe work on a project we were working on. And I was trying to explain to her, like, there's no way I can't think. Like this was also hard for me to articulate what that was like for me. Muscle pain, which we talked about, joint pain, muscle pain, headaches. I experienced my headaches like migraines were how it came to me. And then a fast beating or pounding heart. So it gets a bit confusing, right? Because that can also be anxiety. And I definitely had huge experiences of like rushes of anxiety that would just come on very suddenly.
Can I just jump in here and say something, Ariana? I just want to, can I just point out something here? I want to point out something that what was really interesting about your experience that happens a lot, and I think people don't realize this, is that you can have COVID and feel like you've resolved from that acute illness and get long COVID later, which was in all those words that you read out there. But I just really want to point that out because that happened to you, which makes it even harder to know that this is long COVID, because you can get long COVID from just some patients just never get better. They had COVID and after 4 weeks, they still have their symptoms and they're not better. That's long COVID. But it can also be that you had COVID, you feel like you got over it, like, okay, phew, I'm done. And then it can show up a month later, or even 3 months later, it can show up, which makes it really hard for you and practitioners to figure out what it is, it's why you need to understand that that's a possibility. And that's what happened to you, which I can understand why it may be even harder for your family to understand, like, well, she must just be depressed, or she must just be, just something else is going on. Nobody would really think in their right mind that was still the same disease that you had previously, because but it's really important to know that.
Exactly. Well,
yeah.
And also it was even more confusing because at the time I couldn't get a test to see if I had COVID.
Right.
But the time I was tested, the test was negative.
Yes.
And I had an antibody test, and I actually did go to Providence later for the antibody test, but that was much later. So I had the doctors say, look, we'll do this because we're curious, but the results will really be inconclusive, because if you've had any coronavirus at all, that could pop up. It could be negative. And I was grateful to be talking to doctors at the time, because my acupuncturist was saying, even at the time, a lot of the COVID tests were not correct. So they were seeing people landing in hospitals. She told me a story of someone who was having surgery and they had 3 different COVID tests. And it wasn't until they opened them up that they actually realized they had COVID, because all the tests were negative. Mm-hmm. And so there was also a lot of, I think we're learning now, but there was a lot of discredit that's happened to me, because people said, well, you didn't get a positive test. So even, my MD, he's very, he's a great doctor, but he's like, well, okay, I'm going to listen to that. You think you had COVID, but we have no testing to prove that. And so there's still this, like I've always said to people, well, I believe I had COVID, but, so it's a real, how can I say this in a nice way? It really messes with your mind. It's really hard. If anyone has an autoimmune or anything that's hard to diagnose, it can be incredibly mentally challenging, because people are not recognizing, like what you were saying, Jenny, that something's going on, you're trying to explain it and people aren't believing you.
Right. Yeah.
Yeah. So
I just want to hop in really quick here, because we have a comment on the page, which I think is so relevant, from Lori. And she's saying, a friend is experiencing headaches 4 months post, making it hard to look at screens, both computer and phone. Doctors are telling her they are migraines, and just to drink caffeine, which she eliminated 10 years ago. So I think it's this whole similar idea of everybody starts to think you're crazy and not actually listen to you, or not actually think about the root cause of your symptoms, which can be very infuriating, frustrating, demoralizing for the person that is ill, and is really something to consider.
Yeah. I mean, all of us on this call have all been in this situation. And what I always have to say to you is that nobody knows you better than you do. You know your body. You know if there's something that is off. You know if you're on the right track. You know if you're getting the response from things. You need to like really take ownership of what your experience is and keep knocking on doors and finding people who can hear you and begin to help guide you through that process. So I think it was Lori's friend. I mean, I would say just keep, totally understand and believe what she's experiencing. She needs to know that what her experience is, and to continue to find people to support her who will believe her. It's there's a whole history of people being ignored, especially women being ignored if their symptoms don't fit into the neat little diagnostic box of the current day. And so there's this sort of a little bit of a, a little bit of a Me Too moment in terms of taking that back. Not to say it's not the same for men too. I have men who also get disregarded for their symptoms, but it's a little bit more entrenched, I think, for women.
Definitely.
I think one thing I want to just add to that really quickly too is that there is always the symptom, and then there's the question of, let's look at what's underneath, like what's actually causing this. So, one thing that happens often in the medical world is like, oh, you have a migraine. Well, here's some medication for you.
Yes.
Rather than saying, okay, so why all of a sudden do you have migraines? Like, let's look at what is going on underneath. And I think with any illness, especially these kind of mysterious illnesses that show up, it's always good to ask what is causing this to happen rather than just treating the symptom.
Exactly. Yeah. And we'll get to some more of that in a few minutes too, to talk about that, to help people figure out how, when you're so confused by these chronic conditions, how is it that you can begin to decipher which root cause might be yours? Yeah.
Right. And I wanted to just finish with the last symptoms, which are cardiovascular inflammation of the heart muscle, respiratory lung function abnormalities, renal acute kidney injury, rash or hair loss, neurological. We've all heard you can lose your sense of smell or taste, sleep issues, memory problems, and then depression, anxiety, and changes in mood. And so I want to also say that I have a good friend who also has long COVID. And so it was really helpful to talk with her. She was on a group actually speaking with people who were going through things. So we were kind of comparing notes, like, is this happening to you? Is this happening to you? And it is going to be, bio-individual as well. But then there's these common threads. So for me, some of the things that really cued me in, because I do struggle with anxiety and depression, I have underlying inflammation issues. I've had brain fog and fatigue. So, when I go to my MD doctor, he's kind of like, well, you're talking about all this stuff you already had, right? I get why he would be like, are you sure you had COVID? Mm-hmm. How I know it was different was, one, the fatigue was literally, I couldn't get out of bed for 6 months. And it would go on and off. I'd have some better days, but then I would be back. The shortness of breath. So I have 3 flights of stairs in my house. I'm 45 years old. I walk up and down them all the time. So I don't get winded walking up 1 flight of stairs. And then the anxiety that came on, I knew was very different than what I'd experienced before. It was like I got hit with a freight train, and I literally felt like I could just feel it rushing through my whole body. And then something else that happened to me was a circulatory issue where my feet started to turn purple. And that was nothing that had ever happened to me before. So, and then this dry cough where I don't usually have seasonal allergies, and there's a tickle in my throat. So those were all things that, are really related to post-COVID, just if you are confused. So moving into proper perspective.
Yeah, so I wanted to share with you a little bit of perspective. And just so you know that one of the places that I specialize is helping people with chronic fatigue syndrome, or it's also called myalgic encephalitis, or ME. And when the pandemic first hit, I actually shot a presentation for Fibromyalgia, Chronic Fatigue Syndrome, Myalgic Encephalitis Day. It's an international event. And it was right at the beginning of the pandemic. And I said, we're going to have a second epidemic of chronic fatigue from this, because whenever you have a virus, chronic fatigue can be triggered by 5 different things. And one of them is a virus, and another one is emotional trauma. And this pandemic has been both. It has introduced a new virus into our bodies that our body isn't sure how to respond to always. And it's also been incredibly stressful for all of us. So just a little bit of perspective, this COVID-19, the SARS-CoV-2 virus is novel to us, has been novel when it came in, but the long COVID is not that novel. Few of the symptoms are, but just for a little bit of perspective, after every pandemic, there has been an uptick of people complaining about things that are chronic fatigue, myalgic encephalitis-like symptoms, just like this long COVID. So we've been here before, from West Nile virus, from MERS, from other coronaviruses. When we have a high level of infection, it can trigger get the body gets stuck, and it doesn't kick out the virus completely, and it leaves little virons in the cells, which start to continue to shift your immune system into a way where it's just hard to get all the way well. So we'll talk more about that in a few minutes, but I just wanted to offer that perspective that this isn't the first time we've been here. And I hope that offers some sort of peace, in a sense of like, okay, maybe this isn't completely uncharted territory, because I know there's been a lot of fear of the last couple of years of like, oh my gosh, what's this virus doing? What's it doing? Oh my gosh, now we have this thing called long COVID. And just to know that there are some things that we can pull from what we understand about myalgic encephalitis and chronic fatigue to help heal this.
Exactly. And I think that for me, that was very comforting. So in our community, I was so grateful because I've just been reading everything I can about COVID since it's, started. And so I started to, I'll talk about this more later, but I was like, oh, well, one, I have to have the humility to admit that we don't have immunity towards this. So that was something that scared me, was that people were like, well, we know other stuff, so we'll just have immunity. And I was like, we don't have immunity to it, but what we do have is all this knowledge of how to deal with inflammation and viral conditions in our body. So I just want to say I was so grateful for the education we have in our community, because that was the approach I took. And it helped calm my nervous system down when I thought of it that way. Oh, I know what to do for these things, right?
Right,
so that was
right.
helpful.
So myalgic the ME stands for myalgic encephalitis, and that's what most of the world calls chronic fatigue syndrome. And it's actually, in a way, a better description. One, it sounds way more medical, so people might take you more seriously if you say, oh, I have myalgic encephalitis. They're like, whoa, okay, I guess that's something, instead of, I have chronic fatigue syndrome, I'm tired. Everybody says, I'm tired too, get off the couch. But myalgic encephalitis and chronic fatigue syndrome they are now diagnosable conditions. They were not really considered legit diagnoses until like late 80s, early 90s. Like, it's relatively recent that we've given people credit when they come in complaining. And myalgic encephalitis and CFS is really diagnosed with having ongoing fatigue for greater than 3 months that is not made better by rest. No matter how much you sleep, you still feel tired. And there are a few other things that can be part of it that are part of the diagnoses. One of the problems we have with this is that the diagnosis criteria is actually pretty vague, and it makes it really confusing and hard for patients and for practitioners to effectively diagnose and treat this for that reason. But another one is something called post-exertional malaise, or PEMS. And that's where you do something that's more than what you usually do, and you're absolutely exhausted, even more tired after doing that thing. So say you're, if you're struggling with low energy, doing the dishes and the laundry on the same day is more than you usually do, but you go ahead and do that, and then you're on the couch or in bed with more pain or more exhaustion from doing that extra activity. Or if you're kind of out doing things, but you go for that longer hike, you go for the 7-mile hike instead of the 3-mile hike, and it takes you 3 days to recover. So something like that. in my work of looking at chronic fatigue and myalgic encephalitis, I had a real passion for this because I crashed. I also experienced this, and I was also in bed and very sick. I had to take a year out of medical school to heal, and then got 150% better. Never thought I'd ever get it again, and then I did. And it was terrifying to start going down that slide. And to feel myself getting exhausted again. I was afraid I was going to end up back in bed. So I really had to dive into the literature and figure out, what is this thing called chronic fatigue and myalgic encephalitis? Like, what is it? And how do we get out of this hole? And there haven't been really any satisfying answers out there in the medical community for this. So I just had to put on my own thinking hat and spent years researching this, working with patients, and really kind of began to get this clarity that there are 5 root causes to chronic fatigue. And this is a system and a strategy that I use that I can share. I'm going to share with you to kind of help you understand. And I share with doctors as well to help them understand how to understand what's happening with the person in front of them. So, and this, I just noticed on one of the comments that somebody mentioned in here that Ariana, sounds like your long COVID was just sort of impacting, was triggering some of the stuff that you'd already had going on in your body. And I would say that, yes, that's probably true, that we all come in with this sort of milieu that is us, our terrain, what's your soil like in your body? And, what is it? And that affects how effectively your immune system can respond to that infection when it comes in. And it can also impact which one of these root causes you're going to be more vulnerable to. So you can have an imbalance in your hormones, your adrenal and your thyroid and that kind of thing, and that can lead to exhaustion. You can have toxic exposures. It can be infections. Your mitochondria can not be functioning right, or you can have limbic emotional issues going on. Go ahead and do the next slide. We wanted to just sort of mention that there's a distinction between long COVID and myalgic encephalitis and chronic fatigue syndrome in terms of they're very similar, kind of that whole perspective thing of like, we've been here before. I'd say what makes long COVID stand out from myalgic encephalitis and CFS, like if I was to listen to Ariana, somebody like that who had chronic fatigue and then they had exposure to COVID, and we're trying to figure out, well, how do we label this? Like, do we label this long COVID or we label it as just chronic fatigue? I mean, I think to a certain extent it doesn't matter, because however you're gonna treat it the same anyway, so it doesn't matter the labeling. But I do want to say that I think their type of anxiety that she was talking about is really specific to long COVID. I've heard this from so many patients, of just this sudden, intense, like physical experience of anxiety that just comes on. That's kind of a trip. The circulation and clotting issues, we don't see those with a lot of the other, that's not a classic chronic fatigue thing at all. That seems to be pretty specific to long COVID. The shortness of breath as well seems to be very much a long COVID thing. And then some of the long COVID symptoms that people are dealing with may be due to secondary, due to damage from organs from interventions that they had. Like if you were hospitalized with long COVID and were intubated or had certain medications, your body still may be dealing with the effect of that. And that is contributing to your symptoms of long COVID and keeping your body from getting balanced.
And yeah, to add to that, I just read, the clotting issue and circulation has been talked about for quite a while. And there was just an article I was reading about microscopic clotting that they're finding with COVID. And so, of course, then we think about our system. And if that's happening throughout our brain and throughout our whole system, we can see, oh, yeah, this is going to be very problematic for us, right?
Yeah, yeah.
I want to chime in here too, because as somebody that suffered from Lyme for years, I actually did develop a blood clot in my leg, a DVT after surgery. Right. And so blood clotting is also a real issue with Lyme disease.
Yeah, thanks for bringing that up. That's right. Thank you for bringing that up. Absolutely, for sure. Yeah. Yeah. So when we talk about how do you get out of these situations, and I was thinking about the long hauler name versus long COVID, and I actually am so glad that it's now called long COVID instead of long haulers. And this is a really subtle thing, but I think it has some power to it, because when you think about long hauler, to say I'm a long hauler, you're defining yourself as being this thing that has this long haul set of symptoms. Whereas long COVID is, it's something outside of yourself. It's COVID that's going on a long time, but it's not you. Does that make sense? It's kind of like this really subtle kind of shift between owning it. And I feel like when people are, if you're experiencing things, when you're experiencing chronic illness, and you have brain fog and you have fatigue, it's really hard to know where to go. And I know that Aisha's experienced this with her Lyme, and Ariana has with her chronic fatigue, and I did as well, and you may be too, where you're struggling to know, okay, what do I do to actually get better? And I break this down into these different steps so that you can kind of begin to realize, that there are things that you can do to start getting better. First of all, is just assessing and figuring out what is going on with you, and figuring out which, do you have long COVID or chronic fatigue? What is going on? Which of your root causes is really affecting you? Is it that you have some toxic stuff inside your body that's not allowing your mitochondria to function well? And then you have a virus in your mitochondria that's altering the way that your energy is produced in your mitochondria, and that's affecting you. What is going on with you? And sort of really beginning to dive into your symptoms. Once you figure out what's going on with you, then you can start experimenting, which is pretty much probably where you're at now. And this is what I love this community, because you have such powerful medicine at your fingertips with the essential oils and the supplements that we have access to. And you can start using your body as its own biofeedback machine. It's calibration. It's like what works, what doesn't work. And the call that we did the other day, I loved it when Aaron and Aisha were talking about this as well, from their experience, where you really try things and see, does it work for me? How does it feel? And get feedback. And that's where you're coming up. And then that's how you develop your own personalized toolkit, which is what you need. In a minute, Ariana is going to share her personal toolkit that she used to get herself out of this place of being extremely exhausted into a place of feeling like she has more energy. And then deep cognizance is going deeper in. My belief is that whenever we're in a place that's challenging, we're dealing with a really hard emotional situation, we're dealing with a chronic disease that's really challenging. Whenever we're in a hard place in our life, there's always an opportunity to do deeper work when we're there. And there's always an opportunity to do a deeper detox. This may be leading you to allow yourself to detoxify in a different way. This may be allow you to understand yourself in a new way. There's always a way to do deeper work. And then you get to come out and recode and become the person, your next generation of yourself. Go to the next slide.
I love that.
Dr. Jenny, can I just insert a little something right here?
Please.
This talk really deeply resonates with me because thankfully, I've not had COVID, but as I mentioned, I was sick with Lyme disease for years, with chronic Lyme. And so, all of these symptoms, all of these experiences I've also gone through. It was just with a different virus, with a different friend. And I just wanted to speak to a moment about that point you just made about trusting your own deeper intuition and listening to your body, because I think we're always looking outward for the solution. We're looking for that pill, we're looking for the magic solution. And sometimes we lose connection with really listening to what our own body is responding to, and our own intuition of like, is this working? How is this feeling in my body? And then also the opportunity for some deeper healing when we're in the space. And it's hard. It's hard when you're sick, when you're tired, when you're exhausted, when you have no hope. I am not discrediting that at all. It can become very, very, very overwhelming. But I remember that moment when I actually started taking essential oils and experiencing them in my body. And I had this inner knowing that these were going to be a key tool in my healing of Lyme. And I really started to listen and follow that thread, even though at the time my doctor, he was supportive, but he wasn't, he couldn't really tell me what to do or not to do because it wasn't his area of expertise. So it's just something to really pay attention to and to really connect in and trust the information that your body is giving you.
Absolutely. Yeah. I 100% think it's so important that we take that power back. We take that power back, that, of being able to tap into what our bodies need and to take some control back of our path to healing, right? Instead of expecting somebody else to fix this for me, you go to other people to tap into their experience, to support you on your journey, on where you're going next, because that's what this is.
Yeah, and I would like to say too that two things that I would suggest too is, if you're dealing with this, is I really had to change my relationship to time and be in the here and now. So instead of measuring what I could accomplish in the past, it really helped me to change my mindset. And this might sound crazy to some people, but it worked for me, which was to celebrate any win. Like, I washed that dish, I got that small task done. That's how I started to get better. It was, doing a little bit at a time, I could fold a few laundry, like some laundry, as I answered that email, so that I felt that, I wasn't stuck.
Yeah.
And that I just realized the relationship to time, it was going to take longer than good night's rest or a week.
Yeah.
So I had to really soften to just the experience and being in the present. And the other thing I would say is to be your own advocate. And so I really used my voice. And when people were saying, well, I had that happen and it was just anxiety and an anxiety attack, I said, yeah, I hear you. And that is happening. An anxiety attack is happening. And this is different. And I need you to hear me. I'm trying to explain my experience to you, and you might not understand. So, being your own advocate, or letting people know. A good friend of mine let people know, I actually, this isn't helpful, or you're not hearing me. So to, just to be able to advocate for yourself, and that your experience is real.
Yeah, absolutely.
So moving on to, what do you do if you have long COVID? That's the question, right? What do we do? And so Jenny, go ahead.
So yeah, I want to talk about the foundational 4, because this is, no matter if you have a body, this paying attention to the foundational 4 is going to support you to experience, better health, more immunity, a strong body. It's going to allow you to move from where you are now to a place of greater health. And, literally, these are the health foundations. They're like if you think about a building being built, if you're doing a really big, tall skyscraper, you don't build it on top of a little asphalt pad. You dig down and you build really strong foundations so that building can be strong and withstand the wind and the weather and all those different impacts that are going to happen on that building. And your body's the same. The stronger your foundations are, the more that you're able to handle whatever life is throwing at you. And these are things that, it looks kind of simple, but it's one of those things that you can just keep going back to. So if you're down and out, like if you're feeling really sick, looking at which one of these foundations really is the one that you need to focus on. This is what I do with my patients who are coming in. I have a patient with long COVID, and we looked at this foundational 4, and it's like, okay, what does she really need to focus on? And for her, it was her diet. She had been too tired, and she was giving up on eating healthy food because she didn't have the energy to actually cook for herself. And so she wasn't eating very well. And like, there's no way that you're gonna be able to fight off an infection if you're not choosing every single thing to go into your body as being nutrient dense and supportive. And this is really important. This is something I had to do when I was ill, was literally everything that went in my mouth. It was something that was pro health. It's like every drink, everything, which can be hard, because what you want to do is your emotional eating and, eat your junk food because you feel miserable and there's no hope. But you have to switch and take ownership and be like, nope, I'm going to bring in the good food.
And I just want to interrupt you there. I just want to share with people what actually happened to me was I completely lost my appetite. So I became really depleted, and that I wasn't eating.
Yeah,
really at all.
I had the same thing when I was first sick with chronic fatigue. I wasn't eating, and that was actually a real decision that I had to make to live and to force myself to eat. Like, it was actually kind of really had to choose to eat, and choose to eat very simple food, but just enough to get the nutrition in. I I had to force myself to do that at
That's
that
what
time.
happened to me.
Yeah,
Yeah.
sometimes you just have to do that, which is weird if you're used to eating food and enjoying it, to be in this place where you're forcing yourself to eat. But that's what needs to happen. And sometimes you may need to bring in somebody else to help you if you're too tired or exhausted to feed yourself well, but that's central. The other one, if we're just specifically talking about the health foundations, well, let me just talk about, so rhythm and sleep. So sleep is so essential because you need to keep your inflammation levels down. And sleep is, if you're short on sleep, then your interleukin 6 goes up and you're more inflamed. And you really want to keep that down. So sleeping, having a consistent schedule throughout the day makes a huge difference. And then our breath, especially with long COVID, people have found that doing breathing exercises really helps that shortness of breath. It really is important to allow the lungs to expand and to support them. So doing breathing exercises. And a lot of the protocols in conventional medicine for long COVID and chronic fatigue have to do with this graded exercise type thing for movement. That actually hasn't been proven to be useful for everybody and isn't great for everyone. But what I have to say is that there are some really specific ways that you can learn how to do movement for your body, no matter where you are. And there's, just even lying in bed and imagining yourself doing a yoga pose gives you 60% of the benefit of doing that pose, so just anything that you can do, it can be a very, very subtle movement, allows your body to start moving the lymph and getting that motion in, which can be helpful. And then mindset and spirit, of course, it's hard when you're down, right? When you feel like terrible, you've got all these chemicals in your brain that are making you feel depressed and anxious from the infection yourself. And then of course you're sick, which makes you feel worse. Like you were talking about, Ariana, it's like, yes, this is depressing. I am depressed, but that's not what it is. And I have to say, your mindset trick that you did is so powerful, where you said, yes, today I did one email and that's great. Like, that's good. And that helped you get better. When we start acknowledging the little things in our day and what's good about us and what we've done, it really shifts you start to get a dopamine hit, and it can begin to really lower the whole stress and inflammation cycle in your body. So it's pretty great. Go ahead.
I just wanted to share, this is kind of a funny thing. It's very playful and childlike, but one thing I did was I got a video game while I was so sick because of, I had to turn the news off. I put that in my slide, like it was making me sicker. And in that video game, I was blown away by the art, because I haven't played video games since I was probably very young. But what I was doing, and it came in the most unexpected package, this video game, but I was doing that and I felt it healing me, which the video game, the sounds and the visuals were so powerful. I was exploring ancient Greece, that it was dark and there would be this gorgeous light and there'd be the sound of the ocean. And it was like a warm atmosphere. And I was so sick, but it was taking my mind off of the pandemic and all of the political crisis. And I was literally imagining with every cell I could that I was actually at the ocean. This is when we were in lockdown. And I was playing this video game, but I could smell the salt. I was taking myself back into what it feels like to be the water. I was really like a child pretending, just like when we read a book, that I was actually this person in ancient Greece. And so I just love that you said that. I've done that more through meditation or yoga. And that was more of my spiritual brain going, oh, that's the way we're supposed to do it. But it was really actually very fun to have this childlike, playful part of me help me heal.
That is profound. What you're talking about is profound. That is a huge, what you did is you shifted the chemistry of your brain into a healing state. That's exactly what you did, which means that you literally were flooding all of your cells with a different message that was one of lower the inflammation, of boosting your vitality. I mean, literally, this is really powerful what you did, and you were affecting your limbic brain and your vagus nerve, which means that it was affecting your digestion, your detoxification, absolutely everything. That's super cool. No wonder you're doing better.
It was cool. And I was honestly very ashamed of it, because my adult brain said, like, I didn't want people to come to the door. I was like, oh my God, if people see me playing a video game, it's so uncool. I don't know why I thought that, but I just wanted to share that because it was really powerful. And I also had to laugh. I was working with a therapist and she's like, honey, put some cozy socks on and go play the video game. And she like, that was my like therapy, like homework.
Right. That's hilarious.
And it was pretty great.
I
So
never, ever, I haven't looked at a video game since my kid played Bugdom.
It's pretty mind blowing. It was pretty, as the artist in me was like you have the shadows on the, oh my, like it blew my mind literally. So it doesn't have to be a video game for you if that's not your thing, but there's great meditation apps or a book or just something where you can bring. I love to travel, and that's also how I heal. And I couldn't travel at the time, so I just traveled in my mind. Yes. I was always an avid reader, so it was the same idea as a story,
Yes, that creative daydreaming can be really helpful for healing. So yeah. So for Pastor Vitality, for you to help your long COVID, we want to talk about your assessment, your calibration, your personal toolkit, doing that deeper dive, and then moving into that higher place of your energy. Let's go ahead and just get into the protocols. So what we want to do is talk about how there are different treatments that you can do for different symptoms. And in a few minutes, I'm going to share like a very, very baseline protocol that I would suggest for patients or myself if I was experiencing this. And then I would be picking things from any of the different symptoms that show up from having long COVID. So such as if fatigue is a really dominant thing, you might want to choose some of these types of things to be part of that toolkit, right? So it's like, what's in your toolkit? And you're deciding what's in your toolkit based on how it feels in your body. What happens when you calibrate, when you take this in, and how does it resonate with you or not? Some people do really well with certain oils and other people don't. We all have our favorites, and then we have those ones that don't resonate with us for whatever reason.
Yeah. And I'd like to say too, when I wasn't eating, I couldn't take all the supplements that you'll see that I listed. So again, like the worst thing is to get overwhelmed and not do anything. So if you do anything, like if I could choose one oil, or if I could get one supplement in that very severe time, yes, that was better than nothing, right?
Yeah, absolutely. You have to understand that you need to take baby steps for where you are now and be gentle with yourself. And just trust that you are on your path, and you will be taking steps. And then pretty soon things start shifting, right? You look back and you're like, wow, I'm so much better than I was. Like, that's great. So fatigue pacing is really important, to not spend all of your money or energy at once. You want to kind of do the 80-20 rule. If you have this much energy, you want to hold back 20% and not blow yourself out. It's really tempting if you're struggling with low energy from a chronic disease like chronic fatigue or long COVID, that once you start feeling better, you're like, oh, great, I can do the dishes and clean the kitchen. It's going to be so good. And then you do that, and then you blow yourself out and you feel worse the next day. So you really have to hold yourself back. It's hard. I understand it's hard, but that's another really great time to reward yourself and go like, I did it. I held myself back. I resisted that urge to overdo. And so that's one thing. The Mito2 Max is really a great one because it supports the mitochondria and the adrenals, and both of those are affected. When you look at root causes of chronic fatigue, that hormone triangle has a lot to do with the adrenal glands and that HPA axis, and the Mito2 Max is great with that, as is, and it has a lot of really powerful things in there that support the mitochondria, like the CoQ10 and the L-carnitine. Those are really important, like mitochondrial food. And a lot of people get very exhausted with their mitochondria. We mentioned this in the call the other day, where Ariana talked about how she felt like the Mito2 Max really was a big bump and helped her a lot, which makes complete sense to me, because when you have a chronic viral infection, one of the things that happens is that virus actually goes into your cells, into your mitochondria, where it creates energy for you to have energy to live in your body. and it takes over the freaking mechanism that creates energy, and it starts sucking. It's like if you had power in your house, and then your neighbor comes and taps into your energy of your house and starts draining your energy from you, literally. And you're like, how come my bill is so high? It's because somebody else is freaking taking your energy away. That's what happens. The viruses get in there and do that. So supporting the mitochondria to have more strength and more vitality is super helpful. That's what the D-ribose does as well. There's a number of different things you can do for your mitochondria, but often I have patients just walk out of my clinic with Mito2 Max and D-ribose, and I have them try that for 2 weeks. And honestly, in a week, they're going to know if that's going to help them or not. So that's usually what I do with my patients. Vitamin C is really important for fatigue. It helps the immune system fight off the actual infection, and it also helps your adrenal glands. They need vitamin C to produce their hormones. B complex is just kind of overall really great for energy and fighting off infection and helping balance things. And then I find DDR prime, it's used as a cellular defense. I think it's a really powerful immune supportive product as well, and has a lot of anti-infective essential oils in it. And then there's a huge amount of different herbs and things that you can take. I want to point out astragalus because it's really good for people who are super exhausted. And it's also has been shown to help when one of the things that happens with the immune system when you have a chronic infection. So you have chronic Epstein-Barr virus, you have chronic Lyme, you have chronic, COVID, whatever it is, your body is stuck in this certain immune response called a Th2, and it's just kind of stuck there. And you're not getting that really powerful Th1, I can fight off an infection. It's kind of stuck. And so the astragalus has been shown to help move the body into this different immunological state. So it may make it easier for the body to fight off that infection effectively. Brain fog is it's a total drag. I personally been re-experiencing it with getting reinfected with mold. And I think that what happens to a lot of people with long COVID, with chronic fatigue syndrome, all these different chronic illnesses, Lyme, is that you get a lot of co-infections that go together and can really weigh down the way that your body's functioning. It shifts your body into an altered state. And brain fog can be a side effect of that. Brain fog it can be caused by lots of different things. But one of the things that we're really beginning to discover is that brain fog has to do with your gut microbiome being off, and there being inflammation in your gut, which leads to leaky gut. And if you have leaky gut, you have leaky brain, which means literally that the blood-brain barrier gets swollen in the brain. And so larger molecules of things are able to cross that blood-brain barrier and get into your brain. So that can be toxins, it can be virons, it can be different things that get into your brain. And they think that it is the immune response, the inflammatory immune response to attack those things in your brain that actually is part of why you have brain fog. And so you need to stop that cycle. There's a lot of cycles in these chronic illness patterns that are biofeedback that can make you feel worse and worse and worse and worse and worse until you stop the cycle. So a lot of it is stepping in and stopping the cycle. And with brain fog, there's some really specific things that you can start to do to help that. So I'm a huge fan of the two. Well, let's talk about stop the cycle first. Let's jump down to the proteolytics down there. So proteolytics are things that break down proteins, and you want to take them between meals. Terazyme would have that in it as well, but you may need a higher hit of bromelain, or there's some other products, and that you take that between meals and it helps to break down that inflammatory cycle between the gut and the brain. The astragalus can also help that. There's B vitamins are also helpful for that, which is why I put those in there before. There's a number of other herbs that can help that as well, including the bacopa can really help with brain fog. It really helps people think better. The bacopa does. I love the turmeric caps because the turmeric cap has turmerone, and the turmeric essential oil, different from powders, has turmerone in it. And that actually helps your brain create new neural connections and helps you build your brain back. So, if you have brain fog, you want to have your brain working better. And I personally find the turmeric caps to be super helpful for that. Frankincense is an amazing anti-inflammatory, and it seems to work really well with the brain. So putting it in the nape of the neck, or putting a drop on your finger on the roof of your mouth, or taking it internally are all great ways that I use frankincense to decrease the inflammation in my brain when I'm feeling it. And then this brain protocol that was put together by Dr. Mika Karu is really amazing for helping a lot of the neurological issues that we experience, such as brain fog or tremors or kind of weird, shocking nerve pains. A lot of viruses will get stuck in the nervous system, and they're finding that it's really easy for them to get into the nervous system and stay there, like we see with, we all know about this from chickenpox. You get chickenpox as a kid, right? And then that virus goes dormant and hangs out in your nerves and can come out as shingles when you're an adult under stress. And so similarly, some of these other viruses get stuck, but this brain protocol can be really helpful. And then the GX Assist, I love this product to help support the balancing the microbes in the gut to actually get rid of things that are not super friendly and support the friendly ones.
Jenny, can I chime in just for a moment? I
Yeah.
love this protocol. Before I had Lyme, I didn't even know what brain fog was. I mean, I knew what it was because I had experienced it for years, but I didn't know it was actually a thing. And I just want to give a quick plug for Slim and Sassy, because it was the first, actually, it was sort of my gateway oil into doTERRA. I started using it. It's marketed for weight loss and for metabolism support. But when I started taking it, it within a few days really cleared up my brain fog. And it also helped me with sleep. I had been suffering for about 3 years from bad insomnia. And so it was something that I started taking daily, and it was a game changer for me.
Yeah, the Slim and Sassy is great for detoxification and adrenal support. And I think that that's probably the mechanism why that helped you so much, which is great. Yeah. Yeah. So respiratory function obviously is really challenged with people with long COVID. And you can get that kind of sensation of that heaviness in your chest, like Ariana was talking about, or the chronic cough. And this is where, oh my gosh, are we ever fortunate to have so many amazing oils to use for this? Breathe oil, of course, is great just to have running in a diffuser or to inhale. There's a very powerful protocol that I use that I share with a lot of my patients who are struggling with this, which is to put a drop of Breathe in your hand and then to put a drop of frankincense in your hand and rub it together, and just use your hands as your inhaler and suck it in and hold it. And this really opens up, we find it as a very powerful anti-inflammatory to open up the airways and really support you in that way. I love the Air X. I think it's a brilliant combination. I actually have it diffusing in my room right now.
I just want to say one thing about the Air-X too. The Litsi in there, which is such a great antiviral, just makes me so happy too.
Mood.
So like the mood and the lungs. It's just
yes,
great.
Exactly. It's very mood uplifting, which is great. Thyme is one of those little oils that people forget about. It's so powerful, and it's very powerful antiviral and stimulating, and it really has a great affinity for the lungs. And if you have any other issues like a possible mold exposure, if you live in the Pacific Northwest with us, you might probably do, that thyme is actually a really great one for mold issues as well. Vitamin A has dosing high doses of vitamin A. You want to work with a provider for this, but there are some really great protocols where we do very high, where we're dosing in the hundreds of thousands for just a few days of vitamin A. And this is a really powerful immune supportive. It shifts your body into a state where you can experience that proper immune response that we were talking about. And it has a huge affinity for the tissues in the lung. So that's a really great one. The breathing exercises that I mentioned before. And then Ariana, do you want to talk about the eucalyptus and rosemary? Because I know you've had a really special relationship with them.
Yeah, well, I use rosemary for brain fog I use rosemary. I'll give you my protocol every morning, and eucalyptus. And so I was just making different chest rubs. I was diffusing them. I have a sauna now. I put them in. And then there's been some studies that I was told about, but there was some chemical constituents in eucalyptus and rosemary specifically that they are studying about helping not the COVID virus not replicate, as I understand it.
Mhm.
And so you've got that brain fog, you've got the lung support. And so this was the approach I was taking. I was using, I didn't put in my slide, but time was when I was talking about with COVID immediately, just because of everything I knew about time. And I have lung sensitivities, right? So I was using eucalyptus and rosemary the same way. I'm like, oh, this has just got to be supportive for lungs.
Yeah.
And then, of course, studies are coming out and we're learning more specific to COVID, but super great ones. And just a reminder that eucalyptus and rosemary are in Breathe. So, how perfect.
When we talk about what is it that we're really trying to do when we are in a state of chronic illness from long COVID or any other infection, honestly, is you really want a proper inflammatory response. You don't want a hyper-inflammatory response, and you don't want too low of an inflammatory response. You want to be that sweet spot, at the Goldilocks position of your inflammatory response, where it's right there and it's kind of ready to do that fast action, but then it goes back down to normal. And what you have with long COVID is you have an inflammatory response that's stuck. It's not responding properly. It's not responding properly on the cellular level to what's happening in your body, and you need to unstick it and get it into proper alignment. What you have going on in your body, underlying issues may affect how well your body responds to things. And that's why you have to do that assessment and calibration and find out what works for you and have that individualized treatment plan for you. But again, we have a lot that we know what to do. And what I have to say is that the Foundational Four, and I'm smiling because I'm actually putting together a program for physicians in a few weeks. And I'm diving into this really dense literature about these little pathways inside the cells, and it's a whole bunch of alphabet soup about all these things that are happening in the mitochondria, in the cells, and what's going on with the immune system. And and people are trying to come up with drugs to affect this and to do that and to do this, and maybe that'll work and maybe that won't work. And I'm reading all this literature, and it's like, all right, people, just take a step back. Just take a step back. It's like, what do we really need to do to get this body to not be so freaking inflamed or to be under responding or over responding? It's the health foundations. It's sleeping. It's having a regular cycle. It's breathing. It's moving your lymphatic and your muscle. It's having proper mindset. It's eating the right foods for your body and having your body eliminate your toxins and get rid of things. I mean, that's the answer, and then the stuff and I say gut here because I'd say that for the inflammation response, having your microbiome be balanced, having your digestion work, having your liver work properly, that's just going to give you so much more ability to be able to calm down everything else and stop the stuff that's going on in the brain. So yeah, so these are like just super important. And then mindset limbic, I'll just say, quickly here that the limbic brain is one of the reasons that people get a dysfunctional limbic brain is one of the reasons that people get stuck in what's called a sickness behavior or sickness response or cell danger response. And the limbic brain literally picks up information from the vagus nerve that's in the digestion, it's in the liver, it picks up all this information and says, hey, things aren't okay up here. It tells the brain things aren't safe. We need to shut stuff down so that this body hides out in the cave and stays safe. And it literally sends up information to your emotional brain and says, well, I don't, we got to slow down. And it's kind of dumb in its way of responding. It makes you tired and it makes you hurt. So you hide.
And I just want to add to that I think is really important is that limbic brain isn't coming up to your cortex. So like the part where you could think about it, be the adult, make a rational decision, it hasn't got there. Like you can't use that part of your brain. So this isn't something that's just you're creating, right? It's so deep inside.
Yeah, exactly.
You don't have control over it.
Yeah, I love how you said that. Exactly. You don't. It's pre-thought. It's pre-thought, which is why you experience it somatically. You experience it as fatigue. You experience it as pain. You experience it, those things. And a lot of people with chronic issues, they have a limbic component to it. And when you start addressing that limbic component, then you're able to experience a lot more energy and better mood. So really, really important to look at that. Because it's another one of those, if your limbic brain is inflamed, it continues to shut down the body, and then the body can't respond properly to the infection. But in terms of things to take that are really great for balancing inflammatory response, the deep blue polyphenol is great for that. I like the turmeric caps as well. I should have put in here also probiotics and omega-3s, because actually probiotics and omega-3s will balance out your immune system, your Th1 and Th2, it balances out. So that can be really helpful. So next slide. So circulation is really important to when we talk about specifically about COVID. Well, I guess I should talk about her Lyme experience, right? With the thing with having the blood clot. We want to talk about keeping your circulation going. And when I first started looking at what was happening with COVID, the acute illness, and hearing about all the weird stuff going on with the clotting and with the clots and the microclots and the big clots, I was like, I'm taking resveratrol. I'm like, resveratrol. And interestingly enough, resveratrol is one of a really important food for the mitochondria. So interesting that that's the case. And it's in a lot of our fruits and our berries and naturally, and you can also take it as a supplement. Hawthorn is an amazing plant that is really lovely for the heart. And it helps the heart, physical heart and the emotional heart as well. So that's a plant I go to a lot. Lymphatic massage really helps. Just doing dry skin brushing before you go to bed at night can really help move your lymph and support your circulation system. Obviously, any kind of movement you do is going to help your circulation. And then the Mito 2-Max is great for that as well, as is the black pepper.
I love the crossovers where black pepper is so antiviral, right? So it's like we're using these and it's just
right.
Everything.
Right. Yeah, which I love. So I love this picture you chose here. That's so pretty.
I thought you might like that one.
Thank you. You got me. So what I would say, this is just basic protocol here. And I know it can be overwhelming sometimes to think about all the stuff that we talk about doing, but when you're really sick, it can be helpful to take stuff to really support your body. And so the Lifelong Vitality Pack, the full dose, if it's tolerated, the Mito 2-Max can be really beneficial for a lot of people. I think that a lot of the stuff you've heard everybody already talk about, the vitamin D, the zinc, the vitamin C, having your vitamin A can all be really helpful to support your body. I would say you might need some additional B complex, but there are some B complexes in the Lifelong Vitality Pack, which is why I didn't put B complex down here in terms of trying to keep it simple. The PB Assist, some sort of probiotic is very important. And then rotating through something to help keep your the microbes in your belly balanced, and also having an antiviral effect in your body. So the GX Assist, a Melissa essential oil, we found to be really particularly supportive for people with COVID. And you don't have to do all these things at once, or the DDR Prime, like I mentioned. And then I think it's really important to have some kind of protocol that is addressing the limbic brain. Something like, Ariana was talking about her video game thing, something where you're really diving into healing the limbic brain, the emotional brain. There's also this really interesting theory on that your pineal gland gets off. And so doing things that reset the pineal gland, like I'm wondering if even some of the Kundalini breathing practices might be helpful for resetting the pineal gland. You really have to start thinking about the system is dysregulated. How can I bring it back online? And so things like acupuncture, tapping, mindset work, there's so much that we can do to influence how this all works so that it sends better signals down and then back up. So, and then, like I said, excellent diet.
And electrolytes and fluids.
Yep.
So important.
Yep. Absolutely.
So I tried to keep it simple, but then I made 3 slides instead of 1. But don't get overwhelmed, please, please. So if this looks like a big long list, it's doable. So I was thinking about one, I would advise to get these things out before you get sick. It's really, really hard. It was hard for me to walk upstairs to go get an oil. So that wasn't happening. I have a dear friend who gave me beautiful protocols. And I said, honey, I can't do any of those because I can't even get up, go to get the oils, right?
Yeah.
So have things available, make your little like emergency pack under your bed or something. So in the morning time, lots of water. I did electrolytes as well. Citrus oils are great in the water, great for emotional health. You're smelling them and also detoxing. I would do sometimes one Terrazyme on an empty stomach just to clean my system out, or Terrazyme with breakfast. And this is, I will say, something I'm doing presently, but was not what I was able to do when I was in the thick of it. Like I was saying, I was so sick that I could barely eat. So the supplements, I had to wait till I could get more food into me. PB Assist, a lot of what we've already went through. I would break up my supplements, so I just didn't have to take them all at once. Two Mito, 2 Max, there should have been a little space in there. Adaptive, I went off and on that, like, so if I felt like I needed it, if it was a tough emotional day. And then I put some other things that are not, we think of just supplements and oils and but these are so important. Like bone broth was so important to my healing. Erin mentioned recently to put a drop of celery seed oil in there. I love that idea. I mentioned rosemary rubbed on my head. Oh my gosh, when you're tired and foggy and fatigued, the smell of rosemary is also planted in front of houses historically. It's a very protective energy. So it just feels good to me. And then what I would do is I take it, I put it all over my head, I smell it, and I take 3 deep breaths. And I know Kundalini yoga, so I'd open up my lungs, get that in there, and then also think about 3 things I'm grateful for on each breath. Nice. So that really helped to negate all the scary stuff that was happening in the news in the world for me. I did teas. I love jasmine tea, so I have been drinking a lot of jasmine, but also honey with ginger, lemon, frankincense. I would kind of rotate some of my favorite oils in that. Balance on the bottoms of my feet or other tree oils. I found that to be really helpful for kind of a grandfather, mother protecting energy, just to feel like that. Those trees remind us like we're in it for the long haul, right? Like, so let's use the long haul instead of a bad term like COVID. Like we are strong and steady and we're going to get through this. We have so much wisdom to help you, right? And then lots of stuff in my diffusers. And I also used our humidifier, which really helped just bringing the moisture into the air when I was running cold. So if I have the heat on in the winter, having just that moisture and stay hydrated. And then I actually just gave myself permission to play a video game and sleep and sleep and sleep and rest and calm my limbic brain down. Super important. And then in the afternoon, what I do is I do the LLV, which I find highly supportive. That should say zinc, not Zlink, but that's got zinc, vitamin D, C. I did take extra D and C, and I do that periodically when I feel like I need it. Turmeric caps, I can't sing their praises enough. I brought those in because of what we were learning about COVID. I literally created protocols from the slides we just broke down. Okay, how do I address inflammation, brain fog? How do I support what's happening in my body? DDR prime caps, I love them too. I diffuse the oil as well. And same reason, they are like such an immune booster, and just the oils in there are amazing. This is more recent, but I'm trading Aroma Touches now. I use the Deep Blue stick as a chest rub. That feels really good to me and on my achy joints. And the On Guard products are great. So the lozenges in particular, I love for that dry cough that seems to not want to go away. But I always also use the beadlets. I like the ginger drops too.
Ariana, can I interrupt this for one moment? I wanted to give a little bit of a plug to the DDR Prime. A personal testimonial is, like I had said, when I had Lyme, I developed a DVT, and I took some Chinese herbs for a couple years, and we were monitoring the DVT. And I had very high fibrinogen levels. And when I took the DDR Prime, it was a new product with doTERRA, and I started taking it. It's actually dissolved my DVT. So because we know there are some blood clotting issues, I would think that the DDR Prime is one of the key ingredients to really helping your body support that. So I just wanted to give a little extra shout out to the DDR Prime, and it is something that I still take daily. And it was actually, it stands for DNA damage and repair. So it's also a very powerful anti-cancerous supplement too. So just wanted to add that in.
Yeah, I think the DDR Prime and the AirX are two things that need praises sung about them. So I'll let you read this. You can read it. You can take screenshots. We've talked about a lot of this, so I'm not going to repeat. Copaiba and Serenity Caps. I rotate things out, like Dr. Jenny said. I would rotate out GX Assist sometimes, On Guard sometimes, or DDR Prime. I would just choose, or oregano, I'd choose one of those to kind of, DDR Prime I take more often actually, but I would kind of rotate some of those for immune support. Copaiba and Serenity Caps and the Adaptive are all things that I rotate out for just calming the limbic brain, sleeping, calming the nervous system. Diffuse your oils, use them, put them on your hands, get them on you. And I use the florals, the magnolia, I didn't put down here, and jasmine and rose, such great heart medicine. It really eased my aching heart, because I was also, as everyone, I've been grieving the loss of people, the deaths by COVID, the isolation, the scariness, the news. Something that's been breaking my heart is the polarization. And so I also want to give a praise to Chinese herbs. They help me profoundly. So work with a traditional Chinese herbalist in that area. And then baths have been really important to my healing, being in water with Epsom salts. I'd rotate different oils. And another huge thing that helped me to heal was to go to ancient Greece in my mind and unplug from the anger and the division of the news and the fighting and the attacking. I got really wrapped up in that, and it was making me sicker. So I had to really, I had to have discipline. I had to mama my own self and say, turn the news off for a while. And then I put that picture of that little black cat in there because a really important thing for me was my kitties lying on my chest and purring. And I wanted to say on the 4 that you have, Jenny, I would be so bold to add one more, which is connection. It's vital that loneliness is a huge epidemic right now. So to connect to one another and our loved ones and our animals and our plants and this planet is so important. And then this is great nervous system support. I know we're running over. Do you want to say anything here, Jenny, about this?
Aisha wanted to pop in, I think.
Oh yes, I could talk for an hour.
We could talk for like all day, right?
I just, we really are in the midst of a mental health crisis right now. So many people are struggling from much higher levels of stress, of isolation, of disconnection, of anxiety, of depression. I am not immune of this. It's been a very, very difficult year for all of us. And the adaptive system I found to be a lifesaver. So just quickly, there is a supplement that has GABA in it, as well as ahi flower and there's another herb in it. Passion flower and one more thing that I'm forgetting, but it's so effective at just calming the nerves. So it is something that I take daily, and I take one in the morning and I take one in the evening, but you can also take it for situational stress. So if you're having a really bad day, or if you're feeling an amping up of anxiety, take it. But I like to use it preventatively. I don't want to wait until I'm completely stressed out and full of anxiety to take it. So it is something that I take on a daily basis. Oh, hold on. I've got to plug my computer in. So sorry before it.
And then I'll just speak to that too. It's really helped me with, if you're a person where you start getting into anxiety where it becomes cyclical thoughts and you just feel like you're on a treadmill of picking the next thing to stress out about. We have a joke in our family, like, oh, that thing is resolved. What's your next thing you're going to choose to stress out about? So that's how my brain is wired. So I'm very aware that I've got a lot of fight or flight going on. So I always talk to my brain and I say, oh, you don't have to, you're okay. You don't have to stress out about any, like I literally talk to it like it's a child, you know, like, we're cool. We're just hanging out at home.
I want to thank you, Patty and Diana. It's the scolidium. That's what I was trying to remember. It's a powerful herb that is very calming for the nervous system. So again, this is something that I take every day. It is safe to take with an SSRI if you are on medication. And it's something that has, it lasts about 5 hours in your system. So if it's something that you take and you don't love it, it's going to pass quickly. And also, if you do suffer from really high anxiety and stress, you can take it also with some copaiba, which can help support it and kind of amplify the results. And then also you can use the essential oil with it. So by taking the supplement and applying the essential oil onto your neck, your back, your forearms, your wrists, and or then also putting it in your diffuser, that's going to give you kind of sustained benefits of the supplement. So I just cannot say enough about this product and how effective it is and how well it has worked for so many people. So if you have not tried it, I highly recommend it and putting it in your arsenal of support.
Okay, I had to add a little humor here because this is a heated subject, I know. So someone has to say it, vaccinations, right? I chose this slide because I love this little child's political statement, which was so I will just say, I am not trying to tell anyone what to do what is right for you. But my experience was when I heard about the vaccination, I know enough and I'm not pro or anti-vax. I just wanted to know more. I didn't know. And I was hearing some information that scared me and I wasn't sure what was going on. And I had COVID brain and I was exhausted. And so again, immense gratitude for our community, such a gift. So Dr. Jenny, I got an email about you shared what you were learning. You are like research pro, like real research, not like I read a few articles on the internet and said I did a bunch of research, but really scientific research. And I really appreciated in this letter, Dr. Jenny talked about, hey, I am going down all the rabbit holes. I'm looking at what are concerns people are bringing up, and I'm researching and investigating. And, you shared with our, in the email, what decision you came to, your anxieties about it. And this was so important for me because it really gave evidence-based information so that I could make a proper decision for myself. And what I realized was that a lot of my fears, once I started to learn that actually the vaccination had been around, it wasn't just made in a year or two and there was no research prior, that helped me personally. So I chose to get vaccinated. And the biggest decision, there were two things for me, which was one, I was weighing the risk of, getting COVID again, opposed or giving it to someone else compared to the risk of the vaccination. And because of my experience with long COVID, I was more terrified of long COVID than I was of the vaccination. So that's just my personal thing. And then also concerned for community and healthcare workers, which is really important to me. Doesn't have to be important to you, but important to me. And I wanted to just mention here that I just got my booster, and each time I did get COVID symptoms and was down from 1 to 3 days after vaccinations, I got really scared because it actually reminded me of the intense post-COVID I got, and it would start bringing those symptoms back on. And I actually had an emotional, total freak out response each time. Like, oh my God, this is what I felt like. And they didn't last very long, but I have to say, this last booster, 24 hours of body aches, chills, had to rest, exhaustion. And I actually have been feeling great after that. My pain level's gone down and my energy is up. And so I just wanted to mention that has been my experience.
Yeah, that's interesting because they have been looking at people with long COVID and those who choose to get vaccinated. And there's a certain percentage of them that do get better after the vaccine. And they really think it's because of that place that the immune system gets stuck, and that one process the immune system gets stuck. So it's not actually responding properly. The vaccine pushes you into that other one where, the whole vaccine drives your body into an immune response where you're actually fighting off an infection. It's like it's trying to get you to create this freaking antibody, and so it sounds to me like what happened is that you were stuck, and that taking the vaccine kind of woke up your body and like, this is the thing I need to be fighting. This is what it looks like. Oh, okay. Thank you. And now and then you got into this mode where you're able to, address it. And I think, that has happened to some people who have the long COVID.
Yeah, fascinating. And when you explained it, that made perfect sense in my brain. Like,
yeah.
It's getting my immune system to do what it's supposed to do.
Right. Which I often do with homeopathics, honestly, with people who with chronic other types of infections where we do homeopathics. And I really believe it's doing a similar-ish thing of going, hey, wake up. This is what it looks like. Get this one.
Let's get going. Yeah. So thank you for staying with us. I know this is going a little longer than what we promised you as far as the time, but it's just such good information. I think I love learning, so I just love deep diving and doing this. Dr. Jenny, please share us. She has so many amazing offerings and information. As you can tell, you've been a wealth of knowledge, and this is just the tip of how deep you could go. You want to talk about any of these things?
Sure. Yes. So if you're curious why it is that you're so tired, I actually built out a quiz that goes down like the whole algorithm in my brain of why it is. What's your root cause?
And I just did the quiz.
And it's sort of, it can be really interesting to watch it. So if you're just curious, go check out my website. It's at the top of my website. You can go check that out. I have created a number of online programs to help you guide yourself to a place of more energy and better vitality and to heal. And so if you're interested in having more guidance, if you want more support, if you like doing stuff online, I would love to support you in that process. You can check out, I have a program that goes through the health foundations and mindset, teaches you how to do subconscious work on yourself, has like a natural health toolkit about how, all the remedies you should have in your house in case you get sick. I have a program that helps you if you're dealing with chronic fatigue, myalgic encephalitis, and I'm actually going to use this program for research study for long COVID people. So if you have long COVID and you're curious, check it out. And I also have a practitioner's course that I'm putting out the first weekend of December. It's going to be a live webinar where I'm teaching doctors how to assess and treat these chronic illnesses effectively. So I'm going to be doing all these things are available to you. If you're interested in any of them, frankly, the easiest thing is to just email me, and maybe Aisha can put the email in the.
I will go back really quick. Yeah. Sorry, everyone, but I'm going to just bring up your slide with the email.
But it has that email is drjenny@tfankian. Oh, it's drjenny@drjennytfankian.com. So that didn't get quite in there.
Oh, and that's my bad. Sorry about that.
It's drjenny@drjennytfankian.com for the email. We can just put it in the chat. And go ahead and email me and let me know that you are here. And what I would love to do is I will give you a coupon so you can get a discount off of anything that you're interested in getting. If you have anything on the site that you're interested in, or if you have a question about which program might be best for you, just send me an email. I'll respond to you.
And I wanted to say, when Dr. Jenny, thank you for being willing. I was like, oh, I hope that she has enough time, because I was watching where I follow you on social media. So I was watching all this books and research you were doing about long COVID. And I was over here just like, oh, thank you. And when we were talking together about what do we want to convey in this presentation, we both agreed that the biggest thing was hope. to not lose hope, because it can be hard when you're sick for a long time, but that hope is so vital. And so I just want to close with this quote. I wish I could show you when you're lonely or in the darkness, the astonishing light of your own being. And I just want to say to people who are struggling and maybe they're in long COVID right now, that it is so possible for you to get better. I encourage you to use your creative mind and trust your intuition. For me, like, it was playing video game. Like, who would have thought, right? That was part of my healing. But I had to open up to doing things a different way than I had done them before. That was part of my healing and my message. And there was some deep wisdom that I gleaned through this time. And the biggest takeaway I have is really to be in the moment. And it's making me really cherish my life and being in this moment with you all. It's a great gift that it just reminded me not to take that for granted. And it's not as much about the doing, it's about being. What are we actually, how are we in each moment in our life? Not what are we accomplishing all the time. So that's a different message than society's been telling us for a long time. So those were my takeaways. And I am feeling so much better. I was able to do this presentation. I made the PowerPoint. I'm studying science and research and looking at things, and it's so possible to feel better. And I'm doing all the protocols now because I can do so much more than get up and get a drink of water. So.
Oh, ladies, thank you. This has been an epic hour and a half. So I want to thank everybody for sticking with us. We didn't really put a time on this because we just wanted to flow with it, and you can hop off or join in as you want, but we just felt like we had so much information to share that we didn't want to limit that, because we know how vitally important it is, especially if you need this information. So Dr. Jenny, if you have just a few more minutes, I know there was a pending question, and Ariana, you could actually stop the screen share if you wanted. There was a pending question about how to best detox from the shot. And I wanted to see if you just had a few thoughts to share about that before we wrap up.
Yeah, I'm curious with that question, if that's somebody asking a question in preparation to get the vaccine, or if it's somebody who has had the vaccine and feels like they're having a reaction to it, because the answer may be a little bit different for each of those situations. But what I would say, the best practice that I've been doing, that I did choose to get vaccinated, and I know that that's not everybody's choice. And but that was my choice. And if you're interested in my thinking, I'm super happy to share that email that Ariana, it was like 40 hours of research to write that thing. So I'm like happy to share. But what I was going to say is that what I found to be super helpful is a lot of vitamin C. Liposomal vitamin C is really powerful. So I've been doing liposomal vitamin C. I put myself on a protocol that I did a couple of weeks before I got the vaccination. I did it the 3 weeks in between the vaccination, and I did it a couple of weeks after the vaccine. And I really put myself on there. And personally, I did a lot of work for liver stuff. So Zendocrine is great. Zendocrine essential oil on the liver, castor oil packs with Zendocrine was really good. I drank a lot of water. My diet was super clean. And I took vitamin C, N-acetylcysteine. Oh, that should actually have been on the slide for lung too, N-acetylcysteine. And NAC is really great for detoxification, and also for, it has lots of benefits. So N-acetylcysteine is really beneficial. And the B complex, B vitamins were really great as well. And then I did the resveratrol, and those were some of the things that I brought in, particularly when you're looking at what can this disease cause, what could the vaccine, those are things that I brought in. But I would say the vitamin C was huge. Something weird about the vaccine where it just felt like it sucked all the vitamin C out of my body. And I take a lot of vitamin C, and I took extra before and after. And if there was, like, my teenager didn't want to do a lot of stuff. So like for him, it was just like, take the vitamin C. Here's a liposomal vitamin C. We're taking it with us. Here, stick this tablespoon in your mouth. And that would be the number one thing I would do. And lots of water. And yeah, what I was going to say is that when I got my second vaccine, I had I got sick for a day, and then I felt fine, and then I felt much worse. And I had thought that maybe it had triggered my Epstein-Barr virus. But when I studied it more and understood what the actual immune system response was, I realized actually it was because of my mold reactivation that I have had this year, that's what was the problem. It's put me in this other place. And so for me, I took a high dose of vitamin A for a couple of days, and it shifted my immune system back into where it needed to be, and it took care of that fatigue. And I was like you, Ariana, I got triggered. I was like, oh no,
it's scary, right? It's like, oh, I don't want to get, I've been sick. Now I have a shot that's making,
yeah.
Thank you so much for answering that. Again, everybody, thank you so much for joining us. And I think just one thing to remember here is it really is the small things that we do every day that create lasting change. So by no means, don't wait until you're so ill or fatigued with anything, whether it's COVID or anything. It's the small things we do, taking our supplements every day. We are living in a time where we really do need to supplement, and we have these incredible tools and essential oils and information. And even if you're just starting small, I know these protocols can seem really overwhelming and like, wow, that's a lot. But just starting with the LLV, starting with some lemon in your water, starting with some probiotics, just that alone can be a really, really big support to your immune system. So we hope that this has been empowering. It has been an amazing week with all of our presenters. I just want to thank everybody who's been joining us, all of our doctors, everybody that's been sharing all of their incredible information. Information is powerful. And it's one thing we really love to share is information and education, so you can make your own empowered decisions that are best for you. So have a wonderful weekend. Happy Halloween to everybody. Happy fall. And we'll look forward to connecting with all of you again soon. Bye-bye.
Bye.